am delighted to open our first session. And we're going to hear from a fabulous lineup of experts today defining the scope of the challenges facing people living with TB and diabetes, and discuss solutions to tackle these two diseases through coordinated care, delivered where and when people need it most. So, to get us started, I'd like to introduce our opening speakers. We'll be hearing right now from Sanne Frost-Helt, who is Senior Director of Policy and Partnerships at the World Diabetes Foundation. Then we'll be hearing from Dr. Teresa Kaseva, who is Director of the WHO Global TB Programme. And finally from Dr. Bente Mikkelsen, who is Director of Non-Communicable Diseases at WHO. So, Sanne?
So good morning, everyone, and thank you, Sarah Jane. On behalf of FIND and the World Diabetes Foundation, I want to extend a warm welcome to all of you here. We at WDF are very excited to shine a light on the important topic of TB and diabetes integration. I wish to thank FIND for partnering with us on this event, and we really look forward to further advancing the integration agenda going forward. For those of you who may not be familiar with the World Diabetes Foundation, we are an independent philanthropic foundation based in Denmark. We support diabetes prevention and care in low and middle income countries, and we have done so for the past just over 20 years. Now, why is the interface between TB and diabetes important to prioritize seen from our perspective? Well, we know that the two conditions negatively impact each other, and that treatment of patients with TB and diabetes comorbidity is more complicated and often less successful. It's therefore critical that TB is diagnosed early in patients with diabetes, and vice versa, that diabetes is diagnosed early in patients with TB, so that healthcare professionals treating the patients are aware that if treatment is complicated for the TB, then there might be an underlying diabetes that's actually impacting the treatment. In contexts in low and middle income countries where we have vast underdiagnosis, of course, this poses a significant challenge, and that's really why we're focusing on it. WDF has played a pioneering role in raising awareness of the TB and diabetes intersection. Our engagement on this agenda actually started all the way back in 2008 in a meeting that we held with the union. This paved the way for a series of projects at country level, focusing on diagnosis and care and the comorbidity between TB and diabetes. And in total, we have to date supported 34 projects across 24 countries on this topic. And just to name a few of these countries, we have worked in India, China, Pakistan, Mexico, Brazil, Tanzania, South Africa, and Nigeria, but many more countries, and happy to share if you're interested. In addition, we have worked to engage in global advocacy on this issue. Back in 2016, together with the union, WDF co-organized a summit held in Bali, Indonesia, on TB and diabetes comorbidity, and it led to the Bali Declaration. Recently, our chair, Dr. Anil Kapoor, participated in the consultations on the WHO operational handbook on tuberculosis. And last but certainly not least, at UNGA 78 last year, WDF, my good colleague Bent Lautrup, who's sitting here in the front, spoke, I believe, as the only NCD voice on behalf of non-state actors at the high-level meeting on tuberculosis, emphasizing the need for integrated thinking and approaches. It is, however, important for me to stress that to WDF integration does not stop at TB and diabetes. We need to think broadly about integrated health services at the primary care level. The same person who is presenting with TB and diabetes comorbidity may also be at increased risk of HIV, hypertension, cancer, or maybe pregnant. While we may be reaching targets within one disease area, the same people already have or develop conditions. Hence, we need the need for integrated, people-centered approaches at primary care level. So what stands in the way of this? Tradition, siloed thinking and financing, both within health systems and from funding side, fragmentation, and turf, to name just a few. But these are all surmountable if we put our will and concerted effort behind it. I hope that the next 1.5 hours to 2 hours will provide great insights and inspiration to take the integration agenda forward. To set the scene, we will now first hear from Dr. Teresa Kaseva, Director of the Global TB Program at the World Health Organization, followed by my dear friend, Dr. Bente Mikkelsen, Director of Non-Communicable Diseases at the World Health Organization. Dr. Kaseva, the floor is yours. Thank you.
Very good morning, dear colleagues and friends, and it's so inspiring to see well-known faces and also new. It's good that we are moving beyond our traditional audience, our traditional community, and this is exactly the way we should all follow. It's a special moment, and I already discussed with the colleagues, probably we will, a few years later, we'll commemorate this moment when we came all together and we made some the important decisions that landed the foundation of the successful movement and work. Dear colleagues, as a representative and lead of the TB community, of course, I've been dedicating my time and work to address this century-old problem and is that still kills millions of people. Unfortunately, tuberculosis is one of the biggest top, actually, infectious disease killer in the world, with 1.3 million people dying every year from tuberculosis. And the unfortunately, impact of COVID-19 pandemic was devastating, and the incidence increased, as well as death. As a result of the pandemic, we've received 500,000 excess deaths due to TB. But it's time to learn lessons from the COVID-19, to learn lessons from our previous experience and try to find new, more effective ways. And of course, with the primary focus on TB, we are looking beyond, and luckily my background allows, I have background both in NCDs and we clearly understand that diseases like TB are heavily dependent on social determinants. Yes, that we have 5 key drivers. Diabetes is one of these. According to our last global TB report, with more than 400,000 cases attributable to cases of TB attributable to diabetes. This is a huge number. And if you look at the regional situation, in some of the regions, diabetes is becoming #1 determinant. In other regions, like African region, HIV is a driving determinant. But while we are successfully driving agenda of TB, HIV, we still have to do more to address diabetes and TB following people-centered approach. And this is good time. We had high-level meeting, second UN General Assembly high-level meeting on TB, with clear requests from the member states, from the partners, to address multiple morbidities in the people with TB, with diabetes, and because there is no other way. There is an evidence showing that treatment outcomes are much more poor in these people if they are not addressed, and unfortunately, death as well. So with this, I hope that you will bring us your fresh ideas how we should move forward. From our side, we would like to confirm that this is direction we are planning to go, working hand in hand, and recently developed framework on TB and comorbidities is one of the examples, as well as guidelines that are under development on TB and comorbidities. I would like to thank organizers FIND and World Diabetes Forum for inviting us and for putting spotlight on this topic. Thank you very much.
So with the danger of insulting all other side events, this is actually the one I was looking mostly forward to. Don't tell anybody. But I think this was, and it's so fantastic. Thank you so much to the organizers, FIND, the World Diabetes Foundation. But I also want to take the opportunity to thank my dear friend Teresa Kayasaeva. And I think we need to understand that it takes a village, but it also takes global, regional, and national leadership. And unless I had a colleague like Teresa, we would not have been where we are today at WHO. So you probably don't remember this because unfortunately we all have a very slow sort of memory, or maybe low. But I think it was in 2000 and was it 11 or 12 or 13, where it was a huge meeting on TB organized by the Russian Federation. 17, okay. And that was the first time we had a big TB meeting with a full session of NCD. And from that moment on, Teresa always has challenged me, why am I not in your meetings? So thanks to our partner, we are together. So it is a big honor for me to welcome you all, and I see many familiar and new faces as well. So I think we all understand that these conditions are deeply entwined, and the necessity is for an integrated response. Even if we didn't provide the technical knowledge, we see that more and more people living with these diseases, both TB and diabetes, are calling on us. They are holding us now accountable. I've been to many different meetings where we have people with lived experience telling the story why we need to act, because sometimes they need all of us to act. So as mentioned by Teresa, we have already had a strong and fruitful cross-cutting collaboration within WHO to support this agenda. And I think the latest sort of big breakthrough was actually also another partner, the Global Fund, that started to make an interest of increasing their own investment in TB, HIV, and malaria by also addressing comorbidities. So suddenly there was an appetite for countries to also apply for tuberculosis and diabetes at the same time. I think we need to do more. I think so far it's only one country proposal, but we know that we have at least 30 countries that should be applying for this in that specific way. So the current estimates indicate that the global prevalence of diabetes is projected to surge about 50%. Can you imagine that? 50% from 2021 to 2045. I think we can rightly say this is a tsunami, and is of course also very much linked to the obesity tsunami, as we all have seen really rapidly developing. So there is no question, we cannot make a priority that is different from the epidemiology. When these numbers come, and I think many of you listened to, I think it was 125 interventions during the NCD item yesterday. I haven't taken count on how many mentioned diabetes, but that was a huge amount, because it's not theoretical for the member states anymore. It's something they have to deal with. They see it in front of their eyes, and they see that if we are not early on doing the diagnosis, we will have a huge, impossible burden on the healthcare system, and of course, lack of access. So also probably you know that diabetes is the only of the NCDs that is increasing when it comes to premature mortality, so before dying before 70 years of age. So this is not merely a trend, it is a call to action. And that's why we are gathered here, and it really underscores the imperative of directing greater focus towards the intersection between tuberculosis and diabetes, and we need to do it in an integrated fashion. I need to add that many times, especially during this week, we have had people talking about what is the solution. We see there are shortcomings, so what is the solution? And we have many people raising their hands and they said, it's integration. And then everybody smiles, they go home and are happy. But for me, that's the starting point. What does it really mean, integration? What do we need to do? And that's where we are coming back, for example, to the handbook on tuberculosis, where we have been so happy to contribute under Teresa's leadership on how to practically do this. What can we offer? Who to address, and so on. So from a clinical standpoint, the gravity of the intersection becomes even more apparent. Around 370,000 new episodes of tuberculosis are directly attributable to diabetes each year. 370,000. So by establishing the Global Diabetes Compact, we have been able to establish also a huge partnership. At the moment, I think we have close to 100 partners, and they are willing to help. They are willing to help also when it comes to comorbidities. And we have been focusing on not only prevention, looking into the risk factors, which to some extent also is common between tuberculosis and diabetes, but we have really been looking into what can we do and how can we reach the SDG 3.4, the diabetes targets, but even more now, very actual, the targets of tuberculosis through the high-level meeting that happened last year. And again, you will see the collaboration. You will see the collaboration in member states, because you will find language on tuberculosis and diabetes in that high-level political declaration. And we hope to mirror this when we now move into the high-level meeting of NCD in 2025. So I know that you want me to stop, and I will do that just in a minute. And I know even I can come back. That's excellent, right? So I think we need to be all hand on deck, and that's why we are so many people here today. Thanks again, and look forward for the deliberations. Thank you very much.